Let's talk a little sports medicine. My real good friend, Dr. Joe Congini, is now on board with us live. And, of course, Joe has been part of this show for over 25 years with great sports medicine and just great insight into the world of sports and medicine itself. And good morning, Joe. What do you have for us this morning?
Hey, Ray, I have a topic that I want to talk about that is certainly no fun for me as somebody who's cared for athletes for, up near 40 years. It's a very difficult diagnosis, and it has kind of come into the spotlight with this incredible superstar. I know you've gotten to see him play probably too, this great basketball player, Victor Wembanyama.
Mm-hmm.
Victor Wembanyama is 7'3", 7'4", kid from France, number one draft pick. Many people were saying he might be an MVP candidate, certainly Defensive Player of the Year, and the San Antonio Spurs were playing very well. And in a couple of weeks ago, he's struggling through the All-Star break and things, and they check him out, and they determine that he has a blood clot in his shoulder. And we haven't talked about blood clots in a while, and with good reason. We in sports medicine do not like to see blood clots. They're tricky, they're dangerous, they're hard to pick up, Ray. And although they're rare in younger athletes, I've seen more than a handful in a career, and they're not easy to take care of. Typically, they're in the legs or in the arms of athletes. And recently, I guess it's been a while, the high-profile athletes that you can think back to, Chris Bosh struggled and really had trouble getting back to play with his. Serena Williams, more recently, Brandon Ingram struggled with this. But Victor Wembanyama is a legitimate star, and he's out for the year with blood clots. So what are the symptoms? That's the part that makes this really tough, Ray. The symptoms are not always all that dramatic or straightforward to figure it out. And so very often they just seem like any other injury. There's local pain. I've seen more in the leg than the shoulder, but it seems like a few of these, and Wembanyama's was more in the shoulder. Local pain, swelling, reddish, and warmth to the touch. That's what's made it different for me. If they're red and warm to the touch, I have our trainers, or I go ahead and measure them, because if you see the swelling with this reddish, I'm starting to get a little bit concerned, and we may need to do some testing. There's even a squeeze test called a Homan's test, where you squeeze over this spot where the redness and the pain is, and they may need a workup because we don't want to wait a long time on somebody who might have a blood clot. So people ask all the time, what are the causes of blood clots? So recurrent, persistent injuries that are lasting a few days or a few weeks are one. An oddity is travel, long-distance travel on flights. And that's more in the professional athletes and the college athletes. I myself, because I'm so aware of this, I get up on any flight that's over 3 or 4 hours, and I walk up and down the aisle a couple times, and I do some toe raises and stuff like that to try to get the blood going, because you don't want the blood to be stagnant. There's meds that are involved too. Hormone replacement and cancer meds are the ones that are most known for slowing down this stagnant blood that can lead to blood clots. And more recently, we've studied since the 90s, 2000s, there's some people with inherited blood clotting disorders. And some of our friends in the primary care world and stuff, they actually test people for these clotting disorders, which would put them at risk for sports if they have these. Dehydration is certainly one of the things that we see. And post-op, it happens post-op sometimes. So those are the things. I think the shoulder ones are the toughest to pick up. I've had a few of these, even recently, where we were, thinking about and diagnosing these in the last year. They kind of get stuck between that area of the first rib and the collarbone in people that are doing a lot of overhead activity, and I'm told that's where Wembanyama's was found, is more in the shoulder. They're hard to diagnose, and so the big problem here is the next step is if that clot breaks off, now we move to, we use these fancy medical words. This blood clot is called a deep vein thrombosis, DVT. If it breaks off, it's called a pulmonary embolus, PE. And PEs can break off and go to the lungs through the bloodstream. And if they go to the lungs through the bloodstream, the mortality rate is pretty high. Yeah, that people die from these. And so the mortality rate untreated, Ray, can be as high as 30%. If you do pick up the PE, that mortality rate goes down to 8%. But we don't normally say that in athletes and normal healthy people, that there's a mortality rate. So these are dangerous and they're worrisome. If it just remains a DVT, the mortality rate, the survival rate is much better, 95%. But it is definitely something to seek emergent medical care. If you think somebody has a blood clot as a trainer or a doc or a PT or a parent or an athlete, you want to be emergently evaluated. Go to the emergency room. And then, of course, the other problem is the treatment. And the treatment is medicines. And stronger blood thinners, anticoagulants, are necessary to prevent these clots from spreading, and really, really important to get on anticoagulants. One thing that's important is there are, like everything else in medicine, there's newer drugs out there, even since I was treating these things earlier on. But in the early stages, we may admit people in the hospital for IV anticoagulation to break up these blood clots, because it's a really big deal. And then they progress to where they're taking the medicines by mouth, and then they progress. They're out for at least a month, and then if the blood clots are breaking up and improving, they do some testing, both lab testing and function testing, and eventually these people progress back to playing. And, of course, the last sports that you would play would be heavy contact sports, where you could possibly get back into issues again with recurrences of these blood clots. So it is a big deal. Everybody in San Antonio is feeling pretty good that they picked him up early in Victor Wembanyama, but they were off to a good season, and he's done for the year, from what I understand. And we don't see him that often. 1 to 2 per 2,000 people that play sports. They're rare. But when we do see them, we have to have a high index of suspicion, and we have to get them to the emergency rooms for evaluation.
Joe, I read some stuff, even there was some doctors originally thinking that this could be career-ending for him. Now, since I've read some things where they expect a complete recovery, but my question in regards to a blood clot, could that be a career threat for, say, a high-level sports athlete?
Oh, my gosh, you're all over it, Ray. You're right, for sure. And especially if you have something that predisposes you to these clots, so you get them, they're treated, they break down the clots, and they come back again, and they start becoming persistent, and recurrent, then you really can't play contact sports. Probably the closest was Chris Bosh. He really struggled to ever get back, Ray, and that was the name that was being thrown out there with people. But they really feel, by the very complete workup, what I read too, and I read several articles too, Ray, they said that they feel like a pretty extensive workup with Wembanyama. His does not look like the type that are recurrent, and that once he gets this treatment, once you get this treatment, as long as they're not recurrent, you have a full life expectancy and no further problems. And we hope that this wonderful athlete is going to fall into that category. And as of right now, from what I understand, it looks like he's going to fall in the category of being treatable. Remember, some of the ones that would put you at risk would be these newer inherited clotting disorders. Not newer, it's been over the last 20 years or so that our blood doctors know of these things. But if you have one of those, you may be at risk to never be able to play contact sports again. You're right on it. So we think, in the case of this wonderful athlete, Victor Wembanyama, that his is not one of those, and that his is one that will be treated and that he'll do well. That's the latest that I hear.
That's great for the young man. So successful on the court, and more importantly, good luck, and glad to hear about his health. Joe, great information again, my friend. Terrific visit. Love it again, and we'll connect again next Wednesday.
Okay, Ray. Sounds good. Have a good week.